You're listening to Talk of the Town on 92.7 The Bee, covering issues important to our friends and neighbors in Northwest Alabama.
Well, good afternoon, everyone, and welcome to our inaugural edition of Talk of the Town here on 92.7 The Bee. We are joined today, our very first guest, Ms. Cherie Sibley, who is the CEO of Lakeland Community Hospital. She has graciously come by here and taken time out of her very busy schedule to talk about the hospital and its place in our community here in Haleyville. Cherie, thank you so much for coming by today.
Thank you, Evan, and thank you for everything you've done for our community. This is the first time I've been in the studio since 1985, when John Slatton interviewed me and my teammates when we won the state championship at Phillips High School in basketball. So very nostalgic here. It's nice to see you behind the screen here and with those earphones on, and it's good to be back in the studio. Thank you.
I appreciate you coming by here. It's, of course, Mr. Slatton was the gentleman that encouraged me to get into radio when I was a kid, and I am grateful for the opportunity to take his station on down the road. So
you're doing a great job with it, and we appreciate you here in the community.
And, of course, the hospital is sentimental to me as well, with my grandmother having worked there for years up front. You know, she was the PBX operator there. So
yes, I started my career in the 90s at Lakeland. It was my first real job as a brand new nurse, and I remember your mom very well. She sat behind the counter, she answered the phone, and was always a smiling face for us when we were coming in and off in our shifts.
It's good memories there.
Yes, it is.
And welcome back, of course. You're coming up. This is your 1-year anniversary as the CEO.
Yes, it's hard to believe. It's been a year. We've had a busy year these past 12 months, coming back to the hospital, coming back into healthcare. As you know, I retired and was part of our Healthcare Authority Board, still am, and it's been a real pleasure this past year, an honor to come back. The 90s when I first started, I got to train under some of the greats. Many people on the air would remember Miss Ivan Burnett, Miss Virginia Kirkpatrick, Diane Heck, Kathy Pfeiffer. So then the list goes on and on of the people that I had the opportunity to train under, and who are now all retired, and many still alive and well, and big supporters of our hospital.
So you've got a year back in. Can you give us an overview of what you've been working on since you've been back?
Yeah, so rural America, rural hospitals is a struggle everywhere, not just in Haleyville, Winston County, but all over the country, especially Alabama. So my first priority was to secure our hospital for the future, for future recipients of health care, and that put us into a position where we were looking at the best designation for our hospital. There are 3 hospital designations. One is acute care, which is what we have been since 1969. The next was critical access, which is a rural hospital designation. And then the last is a designation for emergency departments only. So the board and myself and our team worked diligently to understand which designation would be best for our community and which one we met the criteria for. So we worked to get the critical access designation. We got that back in December. That has been a huge lift just in a short 8 months. The hospital leadership team, the directors, the employees all worked hand in hand, not just to fill out the application, which is very labor intensive, but also to go through the surveys. We went through several survey preparation studies. We also went through the Joint Commission survey. We passed with flying colors, and the team did great. But it comes with a lot of hard work. In addition to your daily activities, you had a lot of work that everybody had to incur as we went through the process. But we received that back in December. Now we're in what's called the transition phase, which is it's basically like having a new hospital. So working with all the Medicare payers, the Advantage plans to get us now designated with their contracts as a rural hospital, a critical access hospital. With that, we also, we are definitely challenged. Our old hospital name, Lakeland Community Hospital Acute Care, closed, and then our new hospital, Critical Access, is now open. And so we're in that transition both monetarily as we're waiting on funds to be processed and finishing up all the work that goes into that. So it's been a busy year in this last 12 months.
And correct me if I'm wrong, not to dwell on the negative here, but just to address the issues on there. Your reimbursements from Medicare and from the federal government have been held up during this time, correct?
That's right. And then we went through a government shutdown. So it was...
we dealt with that through the FCC, too. That delayed some stuff we were trying to do.
You understand.
Yes.
Yes, so we're still working through that.
Well, that is wonderful that you have a dedicated team to lead that are going to move you into the next era, next step of staying here, because it's important for us to have this available here in Haleyville, not only through having the services available when we need you, when we're not feeling well, but also to help our industry with insurance rates.
Yes, the hospital, first and foremost is here to take care of our community. And, we've had the benefit of having the care close to home with my parents. They've all used these services along with a lot of other parents. And, it's so nice to be able to look at friendly faces, familiar faces when you're faced with an admission, a hospital admission. And, I know that I know those staff members because I've worked with them before in the years, and they are here to take care of our community. And then I didn't have to drive an hour, nor other family members an hour to take care of family members. So it's great to have that here close to home. Also, emergency care, 24/7. There's a physician here that is here to take care of our community, and that is so important when you whether it be a heart attack that you're having, a stroke, or even just something minor, having a physician 24/7 is such an asset to our community. And a lot of communities, don't have that anymore. I think of Moulton, who, lost their hospital last year. And, those emergency services now, you have to drive a little further. And we're just so blessed to still have us here.
And of course, with your family doctors, you have a wonderful group there through Lakeland Family Practice, through Sonar, through Family Medical. Everyone, you're building a relationship. Even when you're just going for a checkup, you've got a wonderful staff that already knows the patients personally.
That's
and
right.
knows their medical history. They're beyond a chart.
That's right. And we've had, our medical community here is so strong. I think Dr. Harrison may be our patriarch here, having the longest standing clinic. And then Dr. Ragland, who started Family Medical. Many people don't realize that, but I look back. February, of course, is coming to an end, but we definitely gave a lot of shout outs to community members for Black History Month. And I think of Dr. Ragland rolling into town with 2 young children and being the first Black physician in Haleyville. But not just that. I mean, starting as a single parent, starting a clinic here, and then now look at what she has created with Dr. Reddy and Dr. Long. Just continuing to have decades of years of service here in our community. And we're so thankful for not just them, but all of our clinics here in town. And, we support every medical clinic in this community, whether it be physicians, nurse practitioners. There is no clinic that we do not support. We take all patients. We take all admissions. We have physicians not only in our emergency department 24/7, but we have a physician on call 24/7. So if someone needs a patient admitted, then we have that ability to do that for all of our patients, all of our clinics. Regardless what you might have heard, that is here. We are here for everyone.
Well, that is wonderful. Also, you have some other assets that you're bringing in, such as your MRI.
Yes, and we've got some really exciting things coming down the stretch that we'll be announcing soon. But we have an MRI that we've brought to the hospital this year.
Once a week, every week?
It is today,
Gotcha.
but we have plans to expand that.
Wonderful.
Yeah, we also have a new program. It's hot off the press, Evan. You get to hear it first.
Well, wonderful. We've got a 92.7 The Big exclusive here.
You do. So we are working with our geriatric department, and we are transitioning our inpatient geriatric program on the second floor to be an intensive outpatient program.
Gotcha.
Yes. And why is that so important? Today, a lot of the patients that we see on our geriatric inpatient unit is not from our community. Our outpatient program, however, will be for every community, every community in Winston County and in Marion County. We'll have a transportation service, so we will be able to go pick up patients who need outpatient therapy. And, when you get older, I'm getting a little older, but as you get older and you see, your spouse pass away, your friends pass away, depression, anxiety, living alone, we will have a program that will be for all our community, and we'll be able to pick our patients up, bring them to this outpatient service, let them get the therapy they need from a outpatient psychiatrist, a social worker, nurses, dietitians, nutritionists, all the things that they need to be able to handle, any issues that you may have as you become a senior and you get, some of those diagnoses or care challenges as we get older. So we're really excited to bring that. That press release will be out Monday.
Wonderful.
Yeah, we're just waiting on a couple things from the state, and then we'll be opening with our first patient starting April 1st.
Wonderful. So will this be something you're looking directly for the senior patients to get involved with, something that they can get into, or is this you wanting to encourage, like maybe their grown children, to bring them into this program?
Yes, and yes.
Okay, gotcha.
So we definitely have, we have a great senior program. Vicki and Wiley Dean have been managing a program here in Haleyville for quite some time. So it's not to replace that by no means. This is an addition. And we will be able to work with both the seniors, their children, and provide transportation to bring patients in on an outpatient basis Monday through Friday to work with them in a setting and an environment that will help them to continue their independence.
Gotcha. So in case they have children who don't live here and may not can come by and bring them, you can go and get them and
That's
bring
right.
them in
Yes.
safely.
And we have our very own Jan Colburn, who will be our marketing communications leader in that space. And Jan will be available 24, I wouldn't say 24/7. She probably wouldn't like me to say that. But she'll definitely be available to talk to families, to talk to patients. We can go to the clinics. We can go to their home. We can have phone calls to get people in the program.
Wonderful. We'll just say she will be available regularly.
There you go. Yeah, she would like that better.
So what are some of the things that you want to brag on, the folks that have supported you? What are some of your proud accomplishments here?
The thing I'm most proud of are the people. We have a great staff at Lakeland. We've been able to bring back some local community talent. Yeah. We already have some great talent, and we have some out-of-town talent. But the people at Lakeland, all 200 of those employees, I'm just so excited and proud of the work they've done. We also implemented some community outreach. We had a junior volunteer program last year. We had over a dozen young kids from all over the county that participated in that as they look at healthcare careers. It's important, as all of us who are looking at the other end of healthcare retirement, to have good people coming in. And we had a lot who went through the nursing program. We worked with the HOSA students in Winston County, and just really great to see those students who come into our hospital already then go into nursing, radiology, sonography, healthcare administration, legal law, so many things out there. Healthcare is such a diverse population, and there's so many things that you can do. We're also going to be starting an adult volunteer program. We haven't had one of those in several decades, so we'll be rolling that out in May during Hospital Week. So we'll have some informational meetings. So if there are any of you on the air that would like to be part of the adult program, those are, some people call them the candy, the pink coats. The guys can wear blue, but we're excited to be rolling that out and have several areas within the hospital where if an adult would like to volunteer over the age of 21, then they can do so and eat in our cafeteria, which has great food. And please, anyone that would like a good lunch and like a variety, come out and see us. We have a salad bar every day, and that would be a benefit to the adult program as well.
So. Correct me if I'm wrong.
Yeah.
Is this kind of like a modern version of the DO programs that they used to do? Okay, because my grandmother and my great aunt were both in that in the 50s.
That's
so
right.
That's
yes.
wonderful to hear a version of that coming back.
The candy stripers, there's a version of that. Yes.
Wonderful.
Something else I'm really proud of is, our partnerships with our clinics and our medical community. We rolled out a program this year, the hospital did, but it was also important that our clinics have the ability to have the cardiac monitoring. So I had worked with a company before called Zio, and we rolled out the whole cardiac Holtering monitoring, not just to the hospital, to all the clinics. So when patients come in to see their provider, their physician, their nurse practitioner, and there's a concern that there may be some cardiac issues, they can put that Holter monitor on right in the clinic. So being able to roll that out to our hospital, but also share that service with others, and several have shared it on their social media sites, was really an exciting thing for us.
So rural hospital, but pretty cutting edge technology here.
Absolutely, yes.
What is going to be some of the benefits with your new designation? Is it going to make life easier for you being critical access? I mean, because I know a lot of people may not understand the difference, and I'm not sure that I completely understand.
Yeah, so critical access was really set up for rural America. We have to provide service as a acute care hospital 24/7 and as a critical access hospital. But, there are not always things that we need 24/7, but we still have to provide that. So we will now be reimbursed in a way that is better for rural America and rural communities. We have to pay a little more for things in rural America than we do, if you live in a big city. But of course, there's a lot of things that we, have a benefit of, right, living in rural America. But it's harder sometimes for us to recruit top talent, an MRI tech. We are very blessed to have some great ones with Megan Welburn and the team in radiology, but there's extra training that we have to do. So now we'll be reimbursed based on cost, then which is important for us. So that will give us a better leverage in the future as we continue to ensure that our hospital's here for decades to come.
Wonderful. Well, I understand also there has been the controversy, y'all asking for the loan from the city to help cover these the expenses that y'all have had, and of course the delay in funding on there. So we're hopeful that is going to be a solution is going to be reached on there, and you're working on a public meeting right now. We don't have a date for that set yet, but we're going to ask everyone to show up, support you for that, and make sure that we get everything covered that needs to be done.
Yes, and we appreciate that. We appreciate our county commissioners, with the foresight and the ability to sit down with them and them support that, and then we're confident that our city will do the same, and we look forward to that public meeting that the mayor and city clerk is setting up for us, so that we can share our story. We, as I said in the last city council meeting, we are not after free money. We definitely know that there are a lot of needs in our city, and we're just one of many. But we do look forward to those conversations, so that as we continue through this transition, then we have the ability to fund the hospital as we go through it, as those dollars come through.
Want to have a clear discussion to make sure there's no misconceptions or misunderstandings.
That's
there.
right.
We want clarity of all of it. What are there any other avenues of funding that we can pursue to make sure our hospital flourishes other than what's been explored? Now, I know one thing, I saw something the other day, I don't know much about it, but the state was awarding some kind of grant to a hospital in Montgomery that was bankrupt, and I thought, that's a little far down the road before they got. Is there anything out there that can help y'all if you get into a bind that we can pursue?
Yeah, we have. We are knocking on every door. There are grants out there, and we are always applying for grants. And we just received a rural health stabilization grant. We are waiting for the ability to share that on a bigger way. And it helps in some ways. It provides resources, but it doesn't necessarily provide funding today for this issue that we're incurring. So we do check those. We talk with all of our legislators, and we'll continue to do that as we look for opportunities, to be successful going forward.
You talked about you started out at the hospital back in the 90s, and you have been back a year as CEO, but there's a history here also of the transition from it being a privately owned hospital to being owned by the healthcare authority and, in essence, the people of the area. Can you give us an overview of the history of how that came about?
Yes, I'd be glad to, Evan. So the hospital was when it was first started in 1969, it was what was called a Hill-Burton Act hospital. And, we had several little hospitals around town then. We had the Wilson Hospital, the Wood Hospital, maybe Dr. Moore Hospital. I wasn't here then, but those hospitals all came together and formed what is now Lakeland Community Hospital. At the time, it was Burdick West Memorial. And we were a not-for-profit entity. We went through several iterations. We were acquired by Caraway Health, which was a healthcare system in Birmingham, and then LifePoint Health. Went through several management companies, several owners, and then back in 2017, a very scary time for our community as our hospital almost closed. Had noticed that the owners at the time were going to be closing the hospital, and the local leadership at the time, Congressman Adderholt, a big proponent of our remaining open, was and then when the Healthcare Authority was formed. The Healthcare Authority had been in place prior, and then was resurrected, and they were the management and ownership, and have ownership of the hospital today. It's government owned, not for profit entity, and that's important to know. We are not in the hospital business to make a large profit, as many healthcare companies are. We are here to exist for our community and to be self-sustaining, and that's also very important. And with this new designation, I see that ability in the future to be able to be self-sustaining and not even maybe have to rely on the tax dollars that the citizens of Winston County so graciously give every year. So we hope that we can give that back at some point.
Wonderful. Well, you do have, according to a number I saw from the Alabama Hospital Association, a very large economic impact on Winston County. The number I saw was $40 million a year that y'all benefit the citizens of Winston County. Is that number correct?
That is exactly correct. That's done by an independent third party from our hospital association. They do it for all the hospitals in Alabama. And, we think about the hospital first and foremost being a place for, receive care and life-saving care, basic care, and that's, why we're here. But when you look at the business of healthcare, it's huge. It's a huge business for not just the city, but for the country. And the impact here, people say, what does that $41 million mean? And I tell people that's, not only the direct cost of doing care, which is, your salaries, your wages, your insurance, but it's also all the vendors that you have. We buy products from a lot of different vendors, the Milan service, the money that our employees spend in our community because they're here. And without them here, they wouldn't be spending that money. They wouldn't be, going to the Dandelion or Dixie Flowers or Traditions or Jolly Dan's or the Piggly Wiggly, Walmart buying services because they wouldn't be here to do that. And those, all those employees pay occupational tax, they pay sales taxes, as does, the employees, daily here. That would be dollars that would be gone from our organization or from the community if the hospital wasn't here.
And from what I understand, not only do you have the economic impact, you also give back to the community in another way through your foundation that you have.
Yes, we have a great foundation, and so proud of the work that we have done this past year. The foundation is comprised of several community leaders, and this past year, they one of the goals was to provide every Winston County High School a $1,000 scholarship. And then the two larger schools, Winston County, Double Springs, and Haleyville, both got two $1,000 scholarships. We also included Phillips, as Bear Creek is right in our service area, but it was really nice to give those scholarships away last year to our community. We have a lot of fundraisers. Thank you. A big shout out to everyone who participates in our fundraiser activity through the foundation. We had a great time at an event earlier this year when we had a comedian come in. We had dinner and comedy, and it was a sold-out night. We did great there. We also had a Super Bowl type event where we had soup, and we actually delivered all over the community, those who participated, and we have tons more coming. So we appreciate all the support for the foundation for the scholarships.
Well, we'll definitely cover those events, just like with the Super Bowl. We covered that in our Around the Town News, or our Busy Bee community calendar.
Yes, you did.
Specifically. So glad to always have a community event to promote, and especially if it helps out a local nonprofit. Happy to do that. And we will definitely keep apprised of any of the other events that you have come up. But if somebody wants to support your foundation, what's the best way to go about it other than the events?
Yes,
we
always take checks. We always take donations, and they are tax deductible, being that we are a 501. So you can call me, you can contact Tabitha Edwards, contact the hospital and get in touch with us. And it's I think we still have a little time on our taxes that you can still make a donation. If not, we can have it for your next year.
That'd be wonderful. Is there a certain address to send it to, or do you want, we can put that on the website too? So.
Yes, we'll do that. We can put that out there.
Wonderful. Well, Miss Cherie, I sure do appreciate it. Is there anything that you would like to include in closing?
I just want to say thank you for allowing us the time today, and thank you to the community for supporting all our healthcare entities here, not just the hospital, but our physicians, our nurse practitioners, our clinics. It's healthcare is an important business here, but more importantly, we're here to take care of people, and I appreciate giving the support and people trusting us to do our very best job to take care of you.
We're lucky to have y'all.
Thank you, Evan.
Well, Miss Cherie, sure do appreciate you taking the time to come by today, and we appreciate you listening on the air here at 92.7 The Bee to our new weekly interview program. We're going to be doing this at noon every Saturday, and we're going to do a rerun at noon on Sunday. So in case you missed the show, we're going to do a rerun there on Sunday at noon. We will also, we're shooting video as well. We'll have that on our social media pages, on BTV, on YouTube as well. If you want to listen. If you want to watch, please do so. We're glad to have you, and we appreciate you tuning in as always here at 92.7 The Bee. Have a great weekend.
Talk of the Town is produced as a public service by WSHF. If you have a topic you would like to hear discussed, send us an email on our website at HaleyvilleBroadcasting.com or write to us at P.O. Box 21, Haleyville 35565. Tune in again next week to hear more Talk of the Town on 92.7 The Bee.